Good morning and welcome to the 9:30 call. Good morning, Gina
Good morning.
and Wendy. Good morning. We'll give folks a minute to join. We are recording the call this morning. Hey, Linda. Hey, Edna. Brian Dixon has a new headshot. Brian Dixon looking good. That's one of our 2025 goals for team strategies for children. New headshots. Linda is Linda is sending huge hugs to her family childcare colleagues. And Brian says it was time to get a new headshot, um, and stop using the 20-year-old photo when I still had hair. Okay, Brian. Still look good. Good morning, Diana.
Hi, how are you?
Good. All right. Well, welcome to the 9:30 call this week. This is actually our strategies is closing for the 2 weeks starting December 23rd. And then we'll be back in action for January 6th. And so this week we will hear from about a survey conducted by family childcare providers in Massachusetts. Tomorrow we're going to hear from Room to Grow, and then on Wednesday we'll hear from from Mount Wachusett Community College, and then on Thursday we will hear from Commissioner Kershaw, and she will join us with Spanish translations with Excel Linguistics. And then Wednesday night, we have the 9:30 call in Espanol at 6:30 p.m. So we have a packed week this week. We also have on the 17th an event, a webinar about the FY25 budget and what it means to you. So we'll put all that information in the chat. But now I'm going to turn things over to Gina and I'm going to share my screen. So Gina, let me just get your slides up. But the first question that we ask all 9:30 callers is for you to tell us a little bit about you and how you came to be in your current role.
Great. Well, I am Gina Hamilton. I am a family childcare provider from Shrewsbury, and I am several of my colleagues are on as well. Um, we are a group of early childhood educators who, in our spare time, advocate for the family childcare field and for the children enrolled in our programs. We communicate daily in our group of over 1,000 family childcare providers from across the state, and we see what's happening, and we are concerned for the future, ours and that of the family childcare community. So, recognizing this need for the decision makers to see what we are experiencing, we, meaning Edna, Diana, Wendy, Beth, Sally, and others, we wanted the decision makers to see what we are experiencing. So we developed and implemented a survey and then put together this presentation based on the data that we collected.
And Gina, just tell us a little bit more about you.
Oh, I have been a family childcare provider licensed for 10 in Shrewsbury for 35 years. I have a degree in early childhood education and I love what I do.
And you just got back from a long time coming vacation last night.
I
You landed
did.
in Boston and you're closed today and ready to go for the 9:30
Hallelujah.
call.
Yes, absolutely.
We just want to
Absolutely.
acknowledge that. Okay, here we go.
Yes. Okay. So, um, we do hope that this offers you insight and gives you a deeper understanding of the reality of family childcare providers, especially but not limited to the private pay provider. And this presentation shares the highlights, but there is much more specific data available. And we'll be happy to answer any questions and provide details after the presentation.
And so we'll monitor the chat so you don't have to worry about that. But if folks have questions, please add them to the chat.
Perfect.
Okay.
So bringing the picture, oops, sorry,
No, that's
bringing
me.
the
Go ahead.
picture into focus, a data snapshot of Massachusetts family childcare providers. So we did this in November. We asked the over 1,000 providers who comprise the Massachusetts Concerned Childcare Providers Facebook group to participate in this survey. And then 412 responded. 86% said that English is their primary language, and the survey was drafted in English with the option to translate. 377 are homeowners and 32 are renters. We asked our respondents about their education levels, and you can see that over 70% of the respondents have earned college degrees. We have doctoral students, master's degrees, bachelor's, and associates. Well-educated field. 72% or 288 of the respondents have been in the field for more than 10 years. And of those, 62.5% or 180 providers have been licensed for 21 to 48 years. 60% of those who answered this question have previous experience in the early childhood field as center directors, lead teachers, preschool teachers, professional coaches, nannies, paraprofessionals, assistants in centers, and in family childcare programs. So, as most people know, there are different operating models with being licensed for 6, 6+2, large family that are licensed for 10. I think the key takeaway here is that 96% of the providers are open year round, with almost 83% being open Monday through Friday, full day. With regard to assistants, this was pretty well split evenly with those who work alone and those who work with at least one assistant. If you're doing the math right now, you might think that those numbers don't add up, but I wanted to comment that some providers will work with one full-time assistant or one part-time. Some work with two part-time. So that's the reason that you see those numbers look like that.
And can you just remind folks what the regulations say? So when do you need an assistant?
If you are licensed for 6 and you want a 7th child, you have to have an assistant with you.
Great.
There's a lot of information on this slide. As you can see that 357 of the respondents do enroll infants. I think that the biggest takeaway, though, from this information is that currently 50% of the providers have openings. 50% are not working at capacity. 85% reported that they only have openings for children over the age of 2, and 43% reported that they don't have any 4 or 5-year-olds enrolled.
I'm just giving folks a minute to look at the slide. And so Gina, the slide previous, I'm going to go back to it.
Sure.
How do you define full day? Was there a definition when folks were filling out the survey?
34 hours would be, a full day for an assistant?
Or in general, like, so if you say that you are open a full day, is that 8 hours, 10 hours?
It can be anywhere from 8 to 10 or even 11-hour days.
Okay, great. And then anything else? Let's give folks just a minute to look at this slide. So this slide is showing what the survey respondents of who they're providing for right now, of who's enrolled.
Yes, who's enrolled. Yes. Yeah.
Okay, we can go to the next slide.
Our respondents come from every corner of Massachusetts, from over 180 towns and cities across the state. When we asked this question, it evoked a lot of emotion. Do you participate in the subsidy system? 219 do not participate. The most common reasons being reimbursement rate, lack of families with subsidies, and government control. But we found that we were hearing the same comments over and over. So Diana and Wendy are going to read some of those.
Great.
I live in an area where there's minimal voucher spots needed, and those children with vouchers are placed in centers, not FCCs.
The agency won't provide transportation to my town.
There's too much paperwork and too many rules.
The business model just does not work.
I can't meet a budget with voucher payments.
There's no need in the community in which I live.
Center rates increased 34%, while FCC rates, whose rates were already low to begin with, increased 5 to 15% maximum.
In addition to those comments that we heard over and over again, an update on the providers who do participate in the subsidy program, many said that they do not have that they have openings for subsidies, but they cannot afford to continue to hold those spaces, and that they will have to take private if the opportunity arises.
And was the update after the survey ran, or was that part of the same data?
After.
Okay.
For me personally, looking, this is the, I think, most concerning slide that we have. Almost 20% didn't answer this question, but as you can see, 26% plan to remain open only for 1 to 5 more years, and 25.5% hope to remain 5 to 10, and 27% say their decision to remain open is dependent on the C3 funding direction in the next year. So more than a quarter of the respondents plan to close within the next 5 years, and an additional quarter may close without financial support, making 50% of this field unstable. We asked about grant recertification. Clearly, almost everyone recertifies for the grant.
Did you get any information about the 19 that didn't?
Yes, people say that they are not recertifying because, to be honest, the first I would say is that they are upset about the cut, the decrease in funding. Some said that they found that it affected their taxes, and it affected other benefits that they receive.
Okay.
This was something that actually prompted our survey as well. We know that most providers were not taking the monthly survey and updating their information. So we felt it was very concerning that the Department of Early Education and Care was not receiving accurate information. People said they didn't know how to do it, or it was difficult, or they were not getting any help from the help desk. So they just didn't do it.
Okay.
So again, the reasons for not participating: the frustration over the 75% reduction in their funds, some were unaware of the grant.
Wow.
Some said that when their children went to apply for financial aid for college, it was affected because of the grant. And others said that they were losing their benefits like SNAP and Mass Health and fuel assistance. So they opted not to participate in the grant.
Let me just check the chat in case. Okay, so we'll can go to the questions at the end. I'll keep going. Okay.
So when we asked about about the universal or pre-K free pre-K programs, though a mixed delivery system has been discussed publicly, it's obvious providers are not being contacted to participate. 389 providers who responded have not been contacted regarding the universal or free pre-K programs in their communities.
And I would love to see more information about that because I don't know if there are that many communities that are offering pre-K. So did you ask if they had a free pre-K program?
I can tell you that in a recent meeting, we were told that 30 communities have free.
Wow.
Yeah.
Okay.
So this was another one of those questions that evoked a lot of emotion. 64.3% didn't apply for the capital grant. And when we asked why, we were told that the clearly most common response was that as private pay providers, they would not be considered for the grant. And the information sessions clearly expressed priority of the award would be to providers with subsidy enrollments. So providers thought, well, why should I go through all that work? I'm busy enough. Some said they couldn't get the estimates for work in the appropriate time frame. Others said that they were concerned that they wouldn't be able to remain open for the mandatory 2-year requirement. And many had commented that they were looking forward to upgrading their facility, making much needed repairs and improvements, and at the benefit of their enrolled children, but then expressed anger and disappointment at being left out once again.
And so when this question was about the new grant program that was offered just for family childcare or the original?
No, this was about the capital grant, that this was the first year that it was offered.
Okay.
And providers were very excited to have this opportunity to do much needed repairs and maintenance, only to attend the meetings to find out that without being part of the subsidy program and having enrolled subsidy children, they would not be prioritized. So we know that family childcare providers are a vital part of Massachusetts childcare system, but we face increasingly critical financial challenges. If not addressed, these challenges will most likely lead to widespread closures and sharply increased costs for Massachusetts families already struggling with childcare expenses. And we do look forward to working together with the Department of Early Education and Care to tackle these challenges so that all families have access to quality, safe, professional childcare, and that all of us family childcare providers can continue the work that we do. I just have one personal note before we move on. But I think one way to help people to understand the experience of being a family childcare is if you can imagine that we are a rubber band and that in the beginning we're flexible, we're strong, we have high elasticity. But with time, though, comes situations and challenges that stretch us. And we always put the needs of the families first because that's what a rubber band does, right? They hold everything together. So when we're in the beginning, when we're strong and we're flexible, we have families come to us and say, well, we're teachers and we don't want to pay for the summer. So, but we do want you to hold the space for us until September. So we stretch a little bit. And for 8, 10, 12 weeks, we go without tuition and we figure it out. And then we have families who come to us and say, well, we're having a baby next month, and then we're going to have maternity leave or paternity leave for 3 or 4 months, but we want you to hold the space for us. And we do that because, again, we put the needs of the family first, but we stretch. And we're trying to figure out how to make it all work, right? For them, mostly. And then we have the other situations. Oh, we can't pay you for a while because we're getting divorced. We have a medical problem. Someone got laid off. We're having a child custody dispute, a child support dispute. And every time we're stretching, and we're taking the hit, and we're trying to do the best for our families that we can possibly do. But each time we end up using our credit cards to pay for our groceries and going without and that type of thing. But we just keep on doing it. And then the pandemic hits and we go without an income for quite a while and we stretch a little bit more. And then we have to put a lot of money into reopening with the COVID to align ourselves with the COVID restrictions. There's more money. But then and a lot of providers at that point, they broke. Their elastics broke, they had enough, they were done. But those of us who held on, we got some relief because the food program said, you know what, we're going to pay all of you by the higher tier. So we had a little relief. And then the stabilization grants hit, and that was a lot of relief. So it was okay. We were holding on. But then our operating costs tripled. And then the food program returned to a 2-tier system, which for some of us meant a reimbursement difference from $900 to $300 a month. And then the grants got cut. Some providers went from $2,400 to $800 a month. Some went from $1,500 to $500. Big stretches. We are stretched to the maximum. We cannot stretch anymore. In fact, Beth Sidel actually did she went through our page, and from June 1st to November 1st, we averaged 1 provider per week close their program. We can't stretch anymore. And there's no elasticity left. And that's where we are.
Thanks, Gina. I'm just going to run through chat. There was a lot of discussion in chat, but um, so Katie Grossman says, well done, ladies. Tom Weber, given the demand, what are the reasons or theories for FCC vacancies below licensed capacity? And of the 50 not licensed capacity, do we know the percentage that they are under capacity? And then Leslie Baker also added about the cliff effect. Um, Joanne Cravell, proud of our FCC providers in the 508. Titus said, I believe that all school districts have free pre-K. Even if it's just defined as part-time inclusion classrooms. So I'm sorry, my chat is all over the place. So it may be worth further investigation to learn more about the 30 reflected in the survey. That aside, the number of UPK communities has been on the rise thanks to CPPI and local investments, so it may be up to 30. And Brian said it may be in district and not mixed delivery. Rachel said powerful stuff. Thank you, Gina and team. Jennifer Simpson says, must be responding to a question. Shayla, most of, not all, FCC are for profit. I personally am unaware of a family child care provider that works as a nonprofit. Some communities have free pre-K. That's from Beth Sidel. Oh no, my chat just went crazy. Some are involved in CPPI, which I believe is the 30 communities that Gina referenced. Of all those that filled out the survey, is there a breakdown of for-profit and nonprofit providers? How could an FCC even be a nonprofit? Do they work for free? Linda Shoemaker says, by definition, family child care provider is almost for-profit. The nonprofit model is a huge misfit for FCC for many reasons. This does not mean that they're a huge profit. So I think in general, the terms profit and for-profit, when we talk about early education and care, are more about a tax status and not about accuracy of making money or not making money. It's about, and we know this came up even what you saw in some of the surveys about if I'm now getting this other funding stream that I've never had from the government, how does that affect my bottom line? Diana said, true, in our brief capture, profitability was under 20% of tuition at the most. Jennifer Simpson answered Tom's question. Tom, most of us are unable to fill spots for children over 2 years old. What is it, parent bias or other barriers? I believe it is more to do with free preschools that are beginning to be offered. It's hard for us to compete with free. Ashley says, also having younger children limits the number of children you can care for despite your license capacity. Some providers may have a license capacity for 6, but with 2 infants enrolled, you can only have 1 additional child, and that child must be walking, capping it to 3 children until they age up. In my knowledge, many families with older children pull out of FCCs because they feel they should be in groups of peers in school-like settings or in their towns having free preschool options, and we know it's growing. Okay, there's a lot of chat going. I guess as all that, I just read all that chat. I'll keep calling for more. Any other, so I know there are a bunch of folks on the call now, who joined us this morning, and I know many people are watching the recording, so welcome. But Gina or other folks, any reactions to any of those questions?
Well, definitely, you definitely cleared up. I am not aware of a nonprofit family childcare provider, and I think you're absolutely right. It's a tax thing, and it's not the reality. And as Diana mentioned in the chat, when we actually at the end of the year, you may end up with a profit of $18,000 when you're working 9, 10 hours a week, 50 hours a year. I mean, 50 weeks a year. We could actually, most of us could qualify for a subsidy probably.
Right.
So that, and we have seen that it does seem that people are keeping their babies home longer. They're working from home. So
Right.
we're not getting infants at 8 weeks, 10 weeks, 12 weeks anymore. The average is more like 7 or 8 months. And a lot of people public schools are adding to their preschool programs. So there's slots there. Um, and it does seem like the trend is to go to a an actual preschool. So, but you had a million things, so if anyone
I
else.
know. Well, it's great. And keep the chat coming. We'll send it to everybody. Kim Dion said slides from EEC last year prior to the rate increase shows rates for family child. So thank you, Kim, for the data. Donna says the paid family medical leave impact, right? Like, what is this? And I think you'll hear things from centers similarly, right? Like And I think when you think of this, so I would love to turn to solutions with 3 minutes left, but I do think, kind of laying out the structure of like the licensing and the ages and the how many kids you can have is important. And it actually might be helpful to do more of a 101 here on the 9:30 call of just family childcare in general. I know folks from the department are here. Um, so it just that might be helpful just to give everybody the same information as far as grounding. But when you think about the solution, somebody offering the solution, maybe there's some support when you have to hold slots open for families. We know centers have to do the same thing. But when you kind of think about your like the solutions or what we can do to help, what things come to mind? And I guess I'd open that up to Diana and Wendy, anybody and Edna. What solutions would be helpful kind of based on what you heard on this for the survey?
Well, I was just writing in the text that we don't have, after we work 9, 10 hours a day, and like Gina said, 52 weeks a year or taking a vacation or two. We don't have things like health insurance or a 401(k) or, paid sick leave or anything like that, most teachers, most people in the public sector all have. So that's another big worry of us looking to retire eventually.
Did you ask for the providers' ages? I know you asked for experience, but this is something that you all have talked about a lot about kind of like just like where many family child care providers are and how old they are getting closer to retirement age.
We took a survey and included in the questions were how long they had been in the field.
Right.
And there was a lot of data that showed providers that were in the field for 30 to 40 years. We also
Right.
asked how many were planning on closing due to retirement. I believe only 4 responded that they were closing due to
Right.
retirement. So for some of us, unfortunately, we don't have a retirement. We don't have a plan. We don't have any way to just stop working at 65 or 70 because this is our week to week income.
Right.
So it's a little bit of a unique field. I also wanted to comment, it's hard for us to increase our profitability unless we put that price on the parents paying tuition. So we're never able to like take 2 more kids or make it a little more profitable or this model is doing great. Let's, open another classroom. As a family child care provider, our goal is not to open a center from family childcare. It's to maintain what we do and what we've been doing for a very long time. So, I just wanted to point out we're very savvy business owners and we do as much as we can to be profitable and to retain whatever income we can. But it's the business model itself and the regulations really that limit us more than our knowledge or ability to do smart business tactics.
We're seeing a lot of information in chat, a lot of thoughts, a lot of comments, a lot of solution. Catherine Jones said there should be support to help FCC set up their own SCP IRAs.
Mhm.
It's 10 a.m., but so Brian Gold wondered about the food program. Can someone just give a high level overview? Because there was a comment about a long time family daycare food program closed and some immigrants' families are having difficulty.
So the food program, it was Provider Resources that recently closed, and providers could move to Yours for Children or Clarendon, so everybody could find a home if you wanted to find a home. Um, it is currently back to the two-tier system where if you live in a socially vulnerable area or if you have children whose families are at a certain income, you are paid at the top tier, and otherwise you're paid at the lower tier. Um, and it's a substantial difference, actually. I don't have those numbers right now.
That's okay. I just wanted like a high level. Right. So it's basically a support for family childcare, but now the support that was more local, an agency closed, so then folks had to figure out where else to go to get that support. And then there was a kind of new eligibility of the way that you were getting reimbursed. Is that fair to
So,
say?
the state was very good about saying, okay, providers is closing and here's your options.
Right.
So, and then you just contacted them and said, I'd like to sign up with you. Years ago, it was one tier. It was everybody across the state got reimbursed the same amount. And then I don't know, maybe 10 or 15 years ago, they decided let's split this
So they
up.
added like a vulnerable family tier
Yeah.
so that, okay, got
And
it.
then during the pandemic, they said, okay, we're going back to one tier to help everybody.
Oh, I see. And then
And
they
then
changed.
last year they said, oh,
Right.
we're done with that. We're splitting it again. So
Well,
yeah.
this is why we understand why how implementation advocacy is so important because when you have a policy, what that really means. Gina, I can't thank you enough. We know how hard it is for family child providers who are running programs to get on the 9:30 call in the morning. We so appreciate that you have joined us. We are so glad that we recorded this call. I think we would love to do some follow-up, whether it's a 9:30 call in the morning, a 9:30 call at night series, just about really understanding family child care. And can you say one word about who have you shared this data with and what are your plans for the future?
We recently met with some of the members at the EEC, and we do hope to continue surveying the field in hopes to make it stronger and to be able to help providers stay in the field.
Great. Well, thank you so much. And I'm going to post the slides in the follow-up email folder. So thank you for sending those. And I guess one thing, Gina, if you want to add your email to the slide, so if people have questions, and maybe the link to the Facebook group so that people can share that with other providers to join, as a resource, that would be
Sure,
great.
sure. And thank you for your time and for inviting us this morning.
Thank
Great. All right, Gina, thank you so much. And to all the other providers who joined us this morning, great job sharing all the data that you've collected. I wonder, were you inspired by Donna Danette's survey of directors?
I think we were.
Yes.
It's
Absolutely.
good to hear. Yes,
Absolutely.
it's great to hear. Thanks, Diana. Thank you,
Thank
thank
you for
you.
this opportunity.
So we'll make the recording available. I'll make sure Gina and I send it to that group, and so you can share it far and wide. So thank you so much for joining us, and we will see you tomorrow on the 9:30 call. We had over 90 people this morning, so I just also wanted to acknowledge that. I know
Thank
you
you for
weren't looking,
having us.
Gina, and I wasn't going to tell you in the middle, but well done. Well done.
Thank you very
Yes.
much. Thanks.
Okay,
Happy
take care.
holidays, everyone.
Thank you.